Test, test, test. Let me see if.
Hey, good morning from Circuit World in Blue Ridge, Georgia. Where did you get the cricket? Who's got where the cricket? Is there? Was that me? I'm your host, BKP, and it is time for it's beautiful. It's going to be a beautiful weekend in North Georgia. Now, a couple weeks ago, several weeks, I was not able to come on and say, come visit us. So I don't know what is I don't know what I can legally say in this world today, but it's going to be beautiful in North Georgia. I'm not telling you to come, but if you do, I'll wave. How about that? Circuit World, thank you very much. Now, we're getting ready to go out to Sycamore Crossing in a couple weeks, our outdoor location for the summer. Looking forward to that. We have Ask the Doc with Dr. William Whaley. We have Dr. Raymond Tidman with us today. We appreciate them right after these commercials in a minute. Then we have the All-Star Political Panel. The All-Star Political Panel with Jane, Rick, and Bruce. And then we have our Pet of the Week. I am not for sure if Jesse Barton, the Community Relations Director from Cameron Hall, can join us live yet. They have some really strict rules to make sure that nobody's out and about and going into Cameron Hall to make sure their seniors are safe, and we appreciate that and understand that. You know, I keep hearing follow the science, okay? I keep hearing follow the science. Maybe I don't want to be a part of your scientific test. Follow the science, Dr. Fauci, right? On and on. Testing, testing, testing. I would like to know how follow the science goes with collapsing an economy. There's no reason this economy had to collapse that we could not have done things a little different, taken the virus serious as it is, but handled things a little different. If you stop to think about it, hey, this is a New England problem? Whoa, sorry, didn't mean to offend all my friends up there, but seriously, when you get up into New England and you get up into New York, New Jersey, Connecticut, all right? This is not really a Montana problem. This is not really a Utah problem. This is, it's serious, but it's not a problem from coast to coast. But we did shut the country down on a whole. Well, things are starting to open up. What say you? The numbers are not climbing. Is there going to be a second wave? Don't know. Yesterday, the president went out to Pennsylvania, all right? A battleground state to the Lehigh Valley. I just want to give a shout out to my sister Leah and my brother Jerry. They both made national news yesterday. My brother Jerry had a big sign as the president's motorcade went by, said, "Trump, open up PA," and it's made national news. Neil Cavuto opened his show with my brother's sign, and several national articles have been written with that sign up there that he was holding. Thousands lined the streets. Are you hearing that in the news? The motorcade went by, and thousands were lining the streets just to see the motorcade there in Lehigh Valley. News doesn't want to tell you that. So we're going to take a break. We're going to come back. It's time for our coronavirus update with our two great doctors, and we're going to take a break. We're going to come back with that, All-Star Panel, and our Pet of the Week. So, Emily, take us to break.
I'm Jeff Riblett, President of Asset Protection Group. As a certified financial planner and with 20 years experience, I've helped thousands of families and business owners create a tremendous amount of wealth. Fortunately, most of that wealth has been protected. Don't allow an unforeseen life event, such as a nursing home stay or the next market meltdown, destroy your family's wealth. Be smart. Call me. Let's determine how best to protect your assets and preserve your wealth.
Ace is your healthful place for paint and home goods, tools, outdoor living, and lawn equipment. But did you know Ace Hardware of Blue Ridge is a little bit more? We have hunting rifles and accessories for your next hunting trip. We have Amish furniture imported directly from Ohio. And we have Ace Custom Woodworks for all your custom wood project needs, from cabinets to artwork. Ace Hardware of Blue Ridge. We have your new house in stock.
Circuit World has complete queen bedroom packages at amazing prices. Get this queen bed, dresser and mirror, one nightstand, bedding set, and free 32-inch TV, all for only $1799.99 or $129.99 a month. Or get this complete queen bedroom set and sleep in style, also for only $1799.99 or $129.99 a month. What an incredible deal! Stop in today at one of our 5 locations and get the furniture you've always wanted at Circuit World.
It's been 4 generations of family ownership, tens of thousands of customers, and more Chevys than we'd ever be able to count. And more than 60 years later, when we say Days gets it done, we still mean it. With the North Georgia Mountains lowest Chevy prices, a huge selection, and outstanding customer care. See Days Chevrolet in Jasper, and let's get it done.
Days Chevrolet. Days gets it done.
Find new roads.
North Georgia Diamond is your source for diamonds in North Georgia.
Hey folks, we're back. I'm your host, BKP. We're at Circuit World here in Blue Ridge. We want to thank Georgia Cancer Research Center, affiliated with Northside Hospital, for this segment, Ask the Doc. Joining us now, Dr. William Whaley and Dr. Raymond Tidman. Before we get into the list of the subjects we want to cover this morning, it is a worldwide pandemic. We want to bring it all the way home. Let's go with number 1, put it on the screen. This is from Johns Hopkins. A lot of you people trace this and keep up with it daily. Over 4,444,000 cases worldwide. I just want to look there. 1,417,889 in the U.S. Now we're going to drill this right down to Fannin County and home in a minute. Number 2, we're looking at worldwide deaths. 302,493. That's number 2 you see on the screen. Something I want to ask the doctors also, because it is a worldwide pandemic. We drill it down to the United States, and if you look at number 3, the cases confirmed, every one of those counties are in New York. The top counties are in New York. Very far away from Fannin County, Georgia, or Gilmer or Pickens or wherever you're at this morning. Number 4 you see on the screen, all right? The top 20 counties deaths by number of deaths, as you can see on the screen there. Again, top 5, all New York, okay? Now we're gonna drill down here to number 5 that you see on the screen. Total cases, that's the United States. Total number of deaths as of this morning, 7 o'clock when I pulled it, 83,947. And let me pull this up, Dr. Whaley, right here. Lumpkin County, 82 cases. Gilmer County, 105. Fannin County, 36. Union County 36. This is an interactive map on the state of Georgia CDC map. Dr. Whaley, Dr. Tidman, we drilled this all the way down to home. You have sent out some topics this morning that you would like to discuss, and we want to get clear, because I think what we'll call this episode here, clearing up some information out there. And Dr. Whaley, where do you want to start with that? I have the list here. Where do you want to start?
One of the things I wanted to point out was that when you talk about these different counties, say Fannin and Pickens both have 36 as of last night. Gilmer had 102. So Gilmer has one positive case for every 200 people living in the county. Fannin has one case for every 700 people living in the county. And Pickens has one case for every 800. That's pretty close to the same thing. So it's not a high attack rate. The total number per county obviously has got a lot to do with, do you have a chicken plant and how many people live there? And those cases all represent positive tests, not people in the community who might have the virus. And so we get asked, I got yesterday, I guess, 3 or more requests from various people saying, I want you to order an antibody test, and then I want to go to the hospital and do it, or I want you to order a COVID test and I want to go to the hospital and do it. Now, I think both of those things were people who wanted insurance companies to pay for the test rather than going to the community available test where you can drive into wherever. Ray knows exactly where, I don't know exactly where. But the point I wanted to make about it was that that is very little value to that individual person absent a physician to try and help them interpret the value. Yesterday, one of the biggest items in the news, and I'll just read it, is COVID test used at the White House often wrong. A well-done study by New York Langone health researchers say that they miss coronavirus infections 48% of the time. Now that's the White House. The test that they were using was an Abbott ID test, which the FDA gave emergency authorization to in late March because it could be done in 13 minutes on a small machine. And they wanted to get that out of there. So QuickTime would be able to be done locally is a great thing, but the flip side was it had not been tested for its sensitivity and its accuracy, and to have a test that heads you're positive, tails you're not, is not an effective way to screen people at the White House. So if my patient had gone and gotten a test and it had been negative, they could be positive the next day, and then if it's positive in tests that speak up the wrong thing, it just doesn't make any sense. So people still ought to be tested who meet some criteria. Now, healthcare professionals like us ought to be tested. I'm very happy to report that one of the nursing homes in this 7-county area up here tested 100% of their occupants. I think the number is less than 100. They had 80 or 90 people, and they had 0 positive tests. 0. So every nursing home in the country, or every nursing home in Georgia, which has had some terrible nursing home problems, is not a hotbed of the COVID virus. But it is appropriate to have tested all of those people. And Ray's talking about how you protect yourself, but every person that works in that nursing home should be tested weekly and should have their temperature taken twice daily while they're working there. You're trying to protect that high-risk population. So anyhow, the numbers there that you have represent people who have been ill and have been tested under CDC or somebody's guidelines, hospital guidelines at Piedmont Mountainside or at Fannin or whatever, to do the test. and really are very much underrepresenting the total number of people in the country who have had the virus. So I'm going to stop there for a minute and let Ray comment.
Yeah, let me nuance that. I mean, Bill and I have the honor of having a friend who's in the testing business, and so he's able to look at these, a lot of these results. And I want to nuance something you said, Bill. I don't want to totally throw cold water on the testing. It has been marshaled and rolled out in a hurry, and it has not been fully vetted at the FDA, and that's the problem. So you have these little studies going on, and some of them may blow up and say, well, that test is no good. Well, they may do another study later on and say, well, it was perfectly good. So I think we're left as physicians trying to judge and pick amongst these tests and figure out which one looks like it is doing the best job. And that's really on the healthcare profession to really sort through that. And I know you've had a conversation with one of your hospitals, Bill, about, you know, how did they vet their tests. So that's an ongoing debate. I was asked by a friend who's traveling, and he put a good question to me. He said, you know, I hear what you're saying, and I need to go on with my life. I need to better understand how to protect myself. And I thought, well, that's really where we are now. We know the high-risk people need to be protected. And I'm not talking about them. They just need to have everything we can do to protect them. But it's everyone else that needs to go on with their life. And here's what's driving this observation is for the non-high-risk people, if you drill down on the numbers, the risk of death in everyone else is similar to the flu. And we don't change our lives for the flu. Now, nobody wants to get the flu, but it's really in that spectrum of disease of the flu. So they are trying to protect themselves and go on with their lives and then not give it to the high-risk group. It's the high-risk group with their extreme death rate that drags the whole virus across the population into this is an ugly virus thing.
Right.
But for most people, this virus is a flu-like effect. Actually, it's even better because the flu kills all ages, young children, adolescents, teenagers. This virus really unscathingly leaves the young alone. Now, there's stuff in the news right now about Kawasaki and some bizarre, extremely rare children's secondary effects coming up that are showing up. Those they get a lot of flash, there's a lot of stuff to them, and let me tell you, when a doctor sees one of those cases, it's a scary thing, but they're rare as hen's teeth. And that's nothing, anything the general public needs to pay attention to.
Yeah, one of the things that you mentioned there is the regular flu.
Yeah.
Our expert said when somebody calls up and asks, I want to go do a test for the coronavirus, you should apply your regular flu brain to it. Mm-hmm. Now, we don't do flu tests in my office, but you do hundreds of them.
Yeah.
Now, people who have been exposed in their home to somebody that has been diagnosed with flu, they are at basically high risk. Mm-hmm. You would let them get tested if they were sick. Right. You'd give them Tamiflu or whatever. Right. But that test is 65% accurate, just like we were talking before, 35% missed. We accept that today. It's no better today than it was when it was introduced years ago. Okay. Yeah. So then we use our clinical judgment.
Right.
This patient is older, he's got lung disease, he's got the symptoms of the flu, and he's positive.
No, he's negative.
Well, I mean, he's positive. Yeah. I'm going to treat the guy.
Right.
Now, you got the guy who's got the same set of symptoms, and he's negative, and you say, I'm going to treat the guy.
Right. I think the test is wrong.
I think the test missed him.
Yeah.
It's better to treat him.
Right.
And Tamiflu's not cheap, but it's not expensive. Mm-hmm. Give him the Tamiflu. Tell him to stay home. So applying that logic, nobody would ever call you in your office that's perfectly well down at their house and ask you to write an order to send them to get a flu test. You should apply that same logic to the coronavirus test, that there's not any reason to go out and test the healthy. Now, there's reasons to go out and test the healthy when you are an epidemiologist, and I wanted to bring that up today because we had been, a lot of what I'm trying to talk about today, I have picked up from the fact that on the internet, the very scientific group of people studied the different things that have shown up on the internet, and 1 out of every 4 COVID virus internet things is not only terribly inaccurate, but harmful. And that if people go to the internet for their information, focus, that's where you go to find out that the world's flat and we didn't land on the moon. There's a lot of that stuff in there about the coronavirus. So what I want to talk about briefly is herd immunity. You hear the word herd immunity. People are going to have the virus. They're not going to be sick. They're going to get immune, and that will shut down the infection. That shuts down the infection after you've culled the herd. Culling the herd means you've had the deaths.
Yeah.
So you had the flu epidemic of 1917. You got herd immunity after you killed 30 million people around the world. So herd immunity means you've killed off all of the weak ones in the herd, and the bulls and the strong people survive. So here's what I've focused on a few weeks ago, that New York State did a study where they went to a Costco in Manhattan, metropolitan New York. I'm not sure it was Manhattan, but New York City. They tested 3,000 people just walking in the door to buy their Costco foods, and 11.5% had the antibody. Now remember again there's a fudge factor there, and I said, well, if those tests are 65%, you start to say maybe you're 14,000 or something. Well, the 2 studies were reported in the last 48 hours. One, in England, they tested 10,000 of what I would call the walking well, people that are wandering down Marble Arch, and 10,000 of them were tested for the virus. Now, are they carrying the virus? And the number that had it was 0.27%, less than half of 1% were walking down the street with the virus in their nose. Now, France, Germany, and Spain did the antibody test, just still their way of doing epidemiology, like they had done at the New York Costco. The antibody was positive in 4.4% of French walking well, 5% of Spanish walking well, and about 1% of German walking well. So the herd immunity out there is not much. And the last point of this that's very important is that our expert, and if you pay attention to what you really see on the news when there's people talking that aren't talking heads but are scientists, is there has not been one study to show that having the antibody actually protects you from reinfection. That takes a year and a half, and that's why they're talking about the vaccine trials not being a vaccine that's proven to be effective will be a year or 18 months out there. Coming up with a vaccine you can give people might be 3 months or 6 months, but you don't know that vaccine is going to impart immunity. You'll know it's going to make you make antibodies. Now, in many illnesses, tetanus, smallpox, polio, and the things we're used to, having an antibody makes you immune. Well, we know for flu it doesn't do a darn thing, because you got a flu in 2019, you can get it again in 2021 because the B and the A just changed themselves a little bit. So the fact that you have developed this antibody may be reassuring, but it's not any guarantee that you are now immune to the virus and you can wander out there in the world with your bulletproof vest on.
So from there, why don't I jump to the how to protect yourself question. So I want to approach this along the line of trying to help the audience understand the virus, and if you can understand the method the virus uses to grow and spread, which it's, even though it's not a living creature, that's what it's up to, then maybe it's easier to know how to protect yourself. Just go to something really simple. We talk about the flesh-eating Staphylococcus bacteria. That's a skin invader, and it has to get on your skin and attack through the skin. And so, it's on shiny surfaces. You hear about athletes working out in the gym and they don't wipe them down. They end up getting one of these flesh-eating bacteria on. knowing how to clean the surfaces and keep your skin clean is how to stay away from that infectious agent. This virus spreads itself through the respiratory system. And it does so by irritating the respiratory system and causing your respiratory system to spew it out. Okay?
Right.
So that's its strategy. It lives in those membranes and irritates them and causes you to cough and spew. So almost everything that we need to do is think about, well, what in nature kills the virus? Low sunshine kills it pretty quickly. Breezes diffuse it so that its inoculum is diminished, and heat kills it. So kind of knowing that if you're not around sick people who are spewing it, and you are in environments where it doesn't live well, is the best way to visualize how to protect yourself. So to that end, you've got to think about, well, I want to publicly protect my brothers and sisters if I'm going into a closed space where I'm in dead air and a lot of them are there and I don't know them and they don't know me, then I put a mask on, because what I'm doing is keeping that vapor and that moisture on me.
And that mask will prevent 20% of viruses that hit it from coming into you, which ain't too good, but it's going to prevent 80% of your viruses from going out in case you do.
So really, when you're out there and you're wearing a mask, you're not so much protecting yourself, you're protecting others.
That's my exact point.
Right. 20% you're protecting yourself, 80% you're protecting
You're wearing the
others.
mask for your brothers and sisters.
Right.
Now, there is a different mask. We call them N95s, but there are different forms of it which seal to your face.
Right.
And they stop the virus almost 99%, 95%, that's what that 95 is, from getting into you. And that's such a diminished amount of virus that for the sick people, they need to wear that. Now, there are problems with that because, A, the mask gets dirty over time. It irritates you. If you have breathing problems and CO2 retention, you can't stand that mask very long. I mean, there are problems there. And that gets to the whole other issue of masking and gloving and all that kind of stuff. I remember what a thrill it was the first time I ever, as a medical student, scrubbed into the OR. I mean, it is a science. It is more than a religion. And the nurses that guard those ORs make sure that you're doing it right, and they will kick you out of there.
There's nuns in a Catholic high school.
Worse than a nun in a Catholic high school. I mean, you're out of there if you do something wrong. I mean, and what they do is they create for you this image that patient in that sterile field is such that nothing can possibly get in there.
Sacrosanct.
Sacrosanct. So the surgeons, students, and everybody that's involved in that, they go through quite a ritual, getting ready and prepare. They're mentally in that place the whole time they're in that operating room. And when they're done, they back out of that place, and then the nurses close everything up, and you're out of there. That's a focused, disciplined thing, okay? Us walking around in public, at work. I mean, I was telling Bill earlier, this food service worker, I mean, he's 19, he's wearing his mask, he's got his gloves on, and he's got allergies, and between every move he did with my food, he was rubbing his face, and I'm like, is this a Monty Python program here or something? What's going on? But to ask the general public to think about sterility and virus control and all that kind of stuff, hey, the longer you're sloppily doing things like sloppily wearing gloves or wearing a mask all day, it's getting snotted up or dirty, or you've touched it, or you just shouldn't be thinking like that. The best thing to do is say, look, I put the mask on when I need to go around other people to protect them, and when I'm not around them, I take it off and I get it clean, or I have another one around. Okay? But to think that you can go through your entire day wearing a mask or wearing one set of gloves, I think it's a setup for failure. It's like one of the doctors that was constantly in the reporting kept saying, well, don't touch your face. I don't know people that can't touch their face.
You highlighted a study on that one time.
Yeah, a
here.
study of
Right.
medical students where they told them not to do it and why not to do it, and then they followed them around for a day, and 4 times an hour they touch their face.
Yeah, it's more than that, really.
Yeah, we're way more than that. I mean, it's like we've been raised by our mothers for the first 10 years of our lives telling us to keep our nose clean. And she's keeping our nose clean. I mean, we are conditioned to keep our noses clean. But now we're supposed to, one person says, hey, don't touch your face. That ain't happening. So they're unrealistic things, and I think that's one of the main things I want to talk about here is to answer this question is to try to understand the virus and where it lives and how it attacks. And then you can picture how to avoid it. And then be disciplined about the things that you do, that you're selective in when you do them and disciplined about doing them. Trying to do it all day long and make it a new part of your life, I think, is a setup for failure.
Let me go forward with that, because my patients mostly are immune suppressed, okay?
Yeah.
So
Yes.
I've got a patient who has had, he was in the office yesterday, he has had 2 malignancies, but survived on both. Acute leukemia as an adolescent, and a testicular tumor as a young adult, and he is employed in the construction business. And right this minute, they aren't building houses like they do, and he is staying in the house, and he lives on 4 acres tucked at the edge of the National Forest. I said, man, you can go outdoors all you want with your weed eater.
Yeah.
I mean, ain't anybody out there but you and the bears and the squirrels and stuff. And it's sunny out there. Go outdoors. He was staying in the blinking house. And he likes to go out and do yard work and stuff. I says, you are 100% safe. Leave the mask in the house.
Yeah.
It's sunny today. It's going to be 82 degrees. Take your chainsaw out and have some fun. Now, if y'all going back over and build a house someplace, and you're going to be up on the roof, and everybody else going to be downstairs, and you're going to be 6-8 feet apart, go to work. Said, well, we think we're going to be able to start building again in a week. Well, that said, go to work. But since you are immune suppressed, stay 6 or 8 feet away from everybody, and don't let anybody sneeze on you. And recognize that if they're coughing and talking like that, and you walk through that cloud in 10 seconds, they can get you. But if you walk through that crowd in a minute, you're fine.
Yeah.
So that's what we're talking about.
Let me ask you this, because I think there's a couple things that as things progress, people want to hear about. Obviously, there's no study, there's no data for this. Just roughly, how many of us in this country are walking around? Now, some have called it a wicked cold. Some have called it a flu on steroids. But how many of us are walking around, had something for 48 hours, or had something for a day? It's done and over. We've moved on. We don't know it, but we actually had the virus.
So that's an interesting question, because there was a really fascinating
that's
study.
That's
one of the
right.
things that Bill hit on there.
Exactly.
And all of those are spot things in certain counties. The only study that I know about just came out this week or this weekend. It's out of Stanford, and it was privately funded, and they looked at the support staff for the Major League Baseball League.
Yeah. Right.
So these are not the athletes and the coaches. These are the backroom workers, the stenographers, the bookkeepers, the people that clean the stadiums, the support staff. So when you think about it, they're employed and they're urban, okay? But they're all over the country. It was, from the physician's perspective, it was some of a disappointing number, because only 0.7% of them had antibodies. Now, this was one of the best antibody
That's just
tests
like that
out there.
English study.
Yeah. So less than 1% of them showed signs that they had an asymptomatic or a minimally symptomatic infection that was COVID.
So that herd is not immune.
There's no herd there. I mean, it's less than 1%. But the other interesting part of it is it's all over the place. Now, I was real curious about, because I haven't been able to drill down on the study, is that 0.7 for the whole system. Well, there were some pockets in like New York and LA and stuff like that where they may have had a higher percentage, and then other pockets where they had 0. That all blends out to 0.7. So I'm real curious when you drill down on the numbers as to how much it was weighted into certain hot spots.
Yeah, I'll bet Arizona didn't have very many.
Yeah. So that's going to be interesting to look at once this. I mean, all I'm getting is verbal reports on the study. I've not seen the real data, but it's around the country, and it's obviously been around the country for a while. And that's one of my pet peeves about the whole thing that we've been going through here is when they set up these models to drive the program that we're in, they made certain assumptions. Okay. When the models were put into effect and they said, okay, well, this is going to happen, therefore we need to do this, this, and this, that was the best they could do. But when they found out that the assumptions on the model were wrong, they didn't back up and say, well, wait a minute, the things that we made the decisions on wasn't right. And one of those wrong things was when the virus got here and where it was to start with. It didn't just come into one place and spread out from there. It came in multiple places, and it didn't come here in February or end of January. It was probably here in December or earlier.
Yeah.
And those assumptions, those blow the model apart. And anyone who's into mathematics and modeling would understand, well, wait a minute. The assumptions that we began with are wrong. That model's wrong.
Do you know how
we
many
need to
people
rethink the whole thing?
You know how many people call me and say, I think I had it in December,
Yeah.
or I think I had it at the end of the year, or I think one of my kids, they got violently ill and we couldn't figure, but it was, so I think it's right. I want to pose one more thing, okay? Because let's go back a year, because we're talking about reopening and getting back to normal. So let's go back a year, not disrespecting how dangerous this virus is, but I used to attend a lot of sporting events. I don't now, but when I was younger, I wasn't unusual. I went to the 80,000 in the crowd. A couple World Series games, those kind of things is great. But how many people 2 years ago out of 100,000 went to the college football championship game and they were sick? And the wife will put it on the husband, will blame the husband. The wife said, you should not go to that game, you're sick. And he says, I've had tickets for 2 months, there's no way I'm not going.
You're not paying $1,000
Exactly. I got this medication, I'm going to take it, I'll be all right. So you got 100,000 people 2 years ago. 2,000 show up pretty sick that people don't know and you're sitting next to, all right? Then they go home the next week and there's, 10,000 people got a heavy cold, but nobody. Do you see where I'm going with that? And now what we're saying, and generally 2 years ago, like you would say, you've got the flu, you don't go see grandma and grandpa, they're frail just with the regular flu. So what I'm saying is, if you compartmentalize this, like you're saying, in the age group that really needs to be watched and we take care of and treat like fine china, if you're out there living your life and you get sick, don't go see them.
Right.
Stay away.
Right. And I
mean,
we
what
need
about
to hit on that
coming?
every time we do this, because that is a vulnerable age group. If we are respectful and protect them, then we can go about our lives. But we cannot hide and have a dagger in our economy and survive and thrive.
Let me throw one more in there, and then you guys can wrap up the morning, because I want to throw this in there. The Supreme Court of Wisconsin, okay, said, hey, the stay-at-home order from Governor Evers in Wisconsin is unconstitutional. They struck it down, and people made their own decision, and they went to the bar. The bars were full in Wisconsin the next night. People going to the bar where they used to go and see their friends. So if 1,000 people go to that particular bar this week, 3 get sick. To me, it's like 3 getting a cold. I don't know. What say you on the reopening?
They're going to be outbreaks.
Okay, let's stop there for a
Right.
minute, because this happened in South Korea. South Korea
Nightclubs.
South Korea eliminated the virus.
Right.
They had no new cases for like 8, 10 days, 14 days or something. Opened the bars, and in one specific bar, they got about 30 cases within a week, and they shut the bars back down, 5, 6 days ago in the whole country. And they reinstituted a set of their restrictions. So you can't predict that that's not going to happen in Wisconsin. You can't predict.
Right.
Now, I think I saw a picture of that Wisconsin bar, and they were not social distanced. And I saw those other pictures last night where they had those mannequins keeping you from getting 6 feet from each other. And I've been talking to the restaurant owners up here who are talking about how to get people back into the restaurant. So when the idea of opening a bar where you stand at the bar, you go up and get drinks, does not allow the social distancing. So I think opening up and going to the bar is the wrong move. Opening up and going into a McDonald's where they've got every other table blocked off and you can go to a table with your family group but not mix up, that's going to be okay. So I think they overreacted at the bar.
Well, I think I want to bring that back to my general discussion about how protecting ourselves from this virus. And not to rub this in United Airlines' face, but not understanding the why is what creates these ridiculous things. You know, United is blown up this week because they made the decision to leave the aisles, the center seats open to give more social distancing. Well, you're not 6 feet, but, you know, maybe it helps. Then some marketing person came in behind and said, you know, all the nurses and doctors that have flown out free to New York that have been helping in the epidemic, you know, we're going to fly them free back to San Francisco. They put them in the middle seat. Okay? So you have all these people who bought seats on a plane that they think they're being protected that are having the folks that are the most exposed between every one of them. I mean, that's crazy. I mean, it's just, maybe if somebody at the corporate level was understanding the why, they would have said, no, hell no, you don't. I mean, but let's charter a separate plane and put all the people who've been exposed and fly them together because they've been in the mess, but we don't put them between every healthy person that's walking on the plane. So it's that lack of understanding the why.
That's what our friend is doing right now, is advising different groups
on how to protect.
How to protect. I think he's dealing, I shouldn't use, but he's dealing with things like concerts, then
conventions.
Broadway type plays that move around, different things like that. How are if you're going to do that, if you're going to bring Hamilton to Atlanta, who's going to watch it? Well, you're going to put 1/3 of the people in the seats that are 6 feet apart. Well, can we pay to move Hamilton down here? Those are business decisions that have to have medical parts to them. And our friend is spending all day. That's why he's not on here with us. He's spending all of his time trying to help people like United not step on their toe and do something stupid.
You know, I always say, you know, in studying management my life with people, all right, I've had the opportunity for hundreds of people in management. And what I always say is you can't change human nature. Okay, human nature you can't change. You can work all you want on everything else, every characteristic of anybody, but human nature you're not going to touch. People are going to do. And I watch, okay, I watch. I'll say, for example, I think I said this, I flew 2 weeks ago, and I'm in Philadelphia, and everybody's spread out on their own, okay, through all of the, gates. So for one flight, there was like 5 gates where everybody was spread out. And then all of a sudden they started calling the gates. And the next thing you know, everybody was this close getting on the plane in the line. Didn't think nothing about it, okay? That's one thing. Then you go up here to, we'll call it a box store, and they say we've got this many thousand square feet, so we divide it up, and we only want X people inside the store, and they roped off an area, and there's pictures of 100 or 200 people trying to get in the store. And they're in line, and they're not thinking. That's the human nature that we have.
So when you go to Costco and they got you in the line to get their 6-foot markers, and you stand with your bag box 6 feet apart, Costco's doing a great job. I don't know about.
Go out in the parking lot and watch everybody and see how they respond to it. What I'm saying is this something we're going to live with the rest of our lives, the social distance? Because I don't think so. My opinion is every time human nature takes place, okay, it ends. And I think it would take generations and the next generations if we're going to teach a social distancing. I mean, what say you?
I think that's an interesting point. And Brian, I want to validate one of the things that you observe. I mean, of all the people I know, probably your family is one of the most affected. I mean, your father's had medical problems, but he was taken out by the virus. Your mother almost died from the virus. She had a sister and a brother with the virus. So it's
two sisters, two brother-in-laws.
Okay, so you've had six people in the family.
One brother-in-law, 17 days.
Yeah. Okay, and then but the father died, so you've had one death and
3 hospitalized. Mom hospitalized,
and a couple of them really sick, and 1 or 2 walking.
So you have a lot of personal experience with the virus.
Yes, I do.
Okay. At the end of the day, my intuition tells me that we will learn and do a better job of figuring out the at-risk people and how to protect them. And then the rest of us will go about our lives and develop hygiene methods that make it less likely that we're going to come in contact with the virus, and we will rapidly develop treatments and hopefully vaccines. I think that's the way it's going to play out.
Rapidly, though, means a couple of years on the vaccine.
On the vaccine, it may be that time, but there are therapies that, I mean, they're on these therapies. I mean, it's amazing what the pharmaceutical industry is doing. I mean, they've been dead in the water on antivirals and antibiotics. There's been essentially no research going on in this country, and now we're doing some serious research. So I'm excited about that. But I want to break from that for a minute. I think there's this other disease going on culturally. You're talking about human nature. And there is a certain number of, I'm just going to call them sadists, tyrants, or whatever they are, and they enjoy riding people and controlling them. And I'm sorry, there's some of them in office and running around here that are just out of control. And they like that whip in their hand, and they like telling people how to live and what to do. And we have to resist them.
Well, we're not celebrating, to me, when I say celebrate, interesting, but we're not celebrating the people that are recovering. There's never a positive. It's hard to say positive talking about this virus, but there's never a positive story that, you know, for the most part, you can get through it. Now, let's just say this, you know, there's a lot of seniors that my family for years, mom and dad, would go to Florida in the winter, and a lot of seniors go to Florida in the winter for the arthritis, the long list, and don't want to be up in the northern states and it's cold and get the flu or pneumonia, right? So we will say this, I'll publicly say, for years, getting mom and dad to Florida was key. And you don't want, you think, well, my seniors, you don't want them to get, you know, sick in the winter. Let me say this also, you know, my mom was hospitalized for 7 days with this, but she also just came through 6 months of double-hit lymphoma treatments, right, Dr. Whaley?
Yeah, she's
now,
immune
she
suppressed.
just came through these and then got the virus and made it. So all I'm saying is, you know, if you look at the underlying conditions that when the respiratory, which you guys know, it gets attacked, well, you think of all of the things you already have when that gets attacked. So, you know what I mean?
If I could give you the take-home on that.
Go ahead.
Let me use the analogy. You know, sexually transmitted diseases are taboo. Nobody likes to talk about them. Everybody's scared the hell out of them. Sexually transmitted diseases are the wimpiest, weakest infectious agents there are. Now think about what I'm saying there, okay? They do all kinds of destruction, nasty things, okay? But the only way they can be transmitted is very close, personal, warm, moist contact. Anywhere else, it's dead, okay? That agent, that infectious agent is a wimp, okay? It has to be nurtured and cultured and held just in that little tight area. So understanding that this virus is really a weakling, it really is, it doesn't tolerate certain environments at all. We need to understand that and use that to our benefit to deal with the virus and not be afraid of it and move on.
Well, you were talking about social change. Are we going to be social distancing 100 years from now? Our friend, the viral expert, is my closest friend, has not shaken my hand in 10 years.
I think the world of the guy. I get it.
He's done fist bumps. Well, he's going to stop doing fist bumps because you could pass it this way. As you know, in the Indian subcontinent, they greet each other with a bow. In Japan, with a nod. In China, with China with a bow, and in Japan with a head nod. The natives of Central and South America, natives, not the people that moved in, the Europeans, greet themselves by kicking with the foot. So I think Americans are going to come up with a greeting that is not a handshake. I don't believe that you'll have great amounts of handshaking in the future. My dad taught me how to shake hands when I was 5 years old.
I was just getting ready to say.
You get a firm handshake, you look him right square in the eye and say, "I'm really pleased to meet you, Dr. Tidman." There's going to be another way of teaching our children and our boys how to greet one another. I got any idea what it's going to be. Might be. Now,
but you're right. That was something we were taught.
Martial arts guys do it like this to each other. They do it. They do this. I don't know. We're going to come up with something. I have no idea what it's going to be.
Okay, we got to get to moving on, but I want to make sure, because you guys study all week long, I want to make sure we'll go with you, Dr. Tidman. what today did you want to make sure you covered with the audience, or you wanted to discuss before we get out of here?
I want people to stay vigorous, eat well, get outside. You know, my motto right now is stay alive, go outside.
Stay alive, go outside. I like it.
All right. Now, I end up every week with the news of the week. There were 1,578 articles this week, and I usually bring in the top 20, and the last week the top 25, and all of them were COVID virus. So this week, number 15, which is the first non-COVID virus one, is fruits and tea may help fend off Alzheimer's disease. So one more time, we can get back to saying, get a really good diet. Dr. Tidman says, get a little exercise, and maybe our memory will be better. So something else was in the medical news 15 rows down this week.
Folks, we want to thank Georgia Cancer Research Center, affiliated with Northside Hospital, for this segment. We appreciate them very much. You can find this segment on our YouTube channel, FYN TV, Fetch Your News YouTube channel. Ask the Doc. You can also go to our new FYNTV.com website that we just launched a couple weeks ago, and at the top of that it says Ask the Doc. You can click on there. You can find these if you want to. And if you want to send these to your family and friends, you can find them there. Great information. As I say every week, this is the best discussion you can find anywhere. I need to pull back from what I really want to say and go to break. All-Star Political Panel right after this.
Hello, my name is Chad Watkins. I'm the manager at Larry's Body Shop. We are a family-owned and operated business and have been serving the North Georgia area since 1978. We are located at 1216 Progress Road in LOJ, Georgia. Our shop specializes in collision repair, and we work with all major insurance companies. Larry's Body Shop is ICAR Gold, the highest role of training recognized by the collision repair industry. It is estimated that only 10% of collision shops meet these standards. Our shop consists of state-of-the-art equipment such as laser measurement system, down-drive spray booth, spot and MIG welding equipment. All of our paints are mixed on-site so that we can guarantee your paint to match every time. I know that having an accident can be a stressful event. We take pride in making sure our customers are satisfied with the repair of their vehicles. Our waiting area is clean and comfortable with free Wi-Fi and refreshing beverages. So if you're in an accident, stop by and see us at Larry's Body Shop.
Do you feel like healthcare has become too impersonal?
3 times an hour, I'll get you in, I'll get you out.
At Lifetime Medical Center, you're more than a number. We get to know you, not just your medical issues. Dr. Alana Kent is board certified in family practice and offers same-day appointments. She and her staff treat conditions from minor to chronic issues. Lifetime Medical Center, convenient to Jasper and Blue Ridge.
This may sting a little.
Hi, I'm Rhonda the Mattress Lady, and this is my husband Gary, owners of Mattress Overstocked in LJ next to Walmart. And we want to earn your business. From the time you walk in our door to the time we deliver your new mattress to your door, you will see the difference. Our selection and prices are the best in North Georgia, and customer service is our top priority. So y'all come on in and let us help you find the right mattress at the right price. That's Mattress Overstocked in LJ next to Walmart.
Georgia Diamond is your source for diamonds in North Georgia.
In 1981, Reed Nicholson began selling tires out of an old barn in Mineral Bluff. Little did he know that he had just laid the groundwork for the most trusted names in automotive services in the Blue Ridge area. In 1997, Nicholson Tire Center became what it is today, holding the same values of faith, family, and great customer service. 2 locations to serve you, and the Blue Ridge location is currently expanding to offer fast service and the largest U-Haul provider in Georgia. Nicholson Tire Center, Blue Ridge, and Mineral Bluff.
As Georgia opens back up, it's time to come back to Days Chevrolet in Jasper with huge savings on the North Georgia Mountain's biggest selection of pre-owned vehicles. All makes, all models, all with low miles and a super low price. Or buy new and get 0% financing for 84 months on every single Silverado 1500 or Equinox at Days Chevrolet in Jasper.
Days Chevrolet, Days gets it done.
Find new roads.
Hey folks, we are back. Folks, we are back at Circuit World here in Blue Ridge. I always have to, I got to do my test. I got to do my test. Let's see. LJ Circuit World, LJ Circuit World, Blue Ridge Circuit World, Blairsville Circuit World, Franklin, North Carolina Circuit World, Murphy. I got it all 5 from the Circuit World
Murphy,
here.
North Carolina.
Murphy, North Carolina. Right over the hill here.
Just up the road.
5 locations to serve you
Holler
today.
down the hard road. All right, here we go.
All right, folks, and all-star political panel. Jane is social distancing all the way to Texas.
She's out in the car.
Yeah. She said, I'll call in, right?
Yeah.
So our good friend Jane is traveling. Rick, Bruce, I'm glad you're here, but wait a minute. I'm glad I last week and this week I just really wanted Jane to be here to discuss General Flynn and the dominoes that are falling with that. I think we'll still get her in on that. Where you want to start, Rick?
Man, I'm telling you, there's so much going on. So much going on. You know where I'd like to start? I'm tired of talking about COVID-19, quite frankly.
I am too, okay. Bruce, you okay?
I'm okay.
I'd like to get in a little bit the John Durham investigation.
Okay.
That's behind closed doors, though.
Yeah, well,
all right, well,
not in our world.
According to my source.
We do investigative reporting.
Okay, for those
background,
for those at home that maybe don't.
John Durham was the top federal prosecutor in Connecticut, selected by Bill Barr. Bob Barr.
Didn't he find
Bill
once?
Barr.
Wait a
Bill
minute.
Barr.
Let me just throw it out here.
Yeah.
Didn't he once in his career find a little FBI corruption in a certain city?
Just a tad.
So he understands a little FBI corruption. Are you saying?
The big news to me was, okay, you can look at his expansion of the investigative team, and then I don't know if you had a chance to look at this yet, but I get a letter sent to me from a new viewer, possibly in the Chicago area. It's a letter written by an attorney, Ty Clevenger. Ty Clevenger happens to be the attorney that represents Ed Butowski
Yes.
Remember Ed Butowski?
Oh, by the way, Seth Rich is still dead. I had to get that.
No, I know.
I wasn't letting you have that
You
one.
stole my thunder. This is a letter to Ambassador Grinnell.
Yes.
And if some of you don't know it, Ed Butowski was involved in the Seth Rich, NPR, Fox News, Rod Wheeler, that whole thing that evolved after Seth Rich was murdered.
Right.
I thought he was a number 3 bowler on the Rolling Walendas. Butowski, you're up.
That's right. Yeah.
No, Bruce
Butowski. Yeah, not to be confused with, yeah. Just call me the dude. No, let's see.
Moving right along.
Moving right along, yeah. So what he's asked of Grinnell is to help his client. He really would like, he has uncovered the fact that there is a lot of information that will exonerate Butowski if Grinnell will declassify some information that would verify that there was emails that were uncovered between Seth Rich and WikiLeaks.
Right.
Okay? So all of a sudden you look at, okay, that's one thing. And he's got all the senators copied on here. And I mean, it's a well-written letter. It's on the web. We can put it on. We can post it on Fetcher News if you want. And then you look at the Durham investigative team. He is behind the scenes adding people like there's no tomorrow.
Yes.
To his investigative team, including FBI. And the one that really sticks out that kind of ties the whole thing together, he has brought in the Chief Violent Crimes and Narcotic Traffic Sectioning Attorney's Office in Washington, headed up by Anthony Scarpelli. What is Anthony Scarpelli background? He was the investigator for a long period of time into the Seth Rich murder. Okay? All of us, you've got Durham, and Durham is so pinpoint precise in the people that he brings on. He doesn't bring them on just willy-nilly. He brings them on because they have a specific specialty.
Right.
And the specialty that Scarpelli has is FISA abuse and the potential of this violent crimes in the D.C. area. So I really believe that there's just too many dots that are starting to connect.
But if go ahead.
Well, when you go to the Durham investigative team, and then you see a letter by an attorney asking for Seth Rich is the common denominator in a lot of this stuff.
Absolutely.
But dead men don't talk.
Dead men don't talk, and nor do the Clintons. But
going back, Durham, what's his background? And he was appointed by Barr 9 months ago,
Yeah,
specifically to look at what?
The origin. Barr has said he wants to go back to the beginning. Point
exactly.
one, right. He wants to
Exactly.
go back to the origin.
I think it's for the viewers just to point that out.
He's expanded significantly the amount of work that he's doing. He's now involved with Crossfire Hurricane. That just came out. Barr said that in an interview this week. Durham's investigation into the origins of Crossfire Hurricane. Then he brings Scarpelli on. He's also brought in 2 FBI guys that were assigned to the Valerie Plame. Wasn't she the one that was outed?
Yes.
Yes.
Okay, he brought the 2 guys. He brought 2 FBI guys in that were responsible for the investigation in that. Now you can't tell me that this doesn't have some kind of a relationship.
Well, let's say this.
That goes back to Scooter Libby.
Exactly.
Valerie Plame.
Yeah.
I did that on the show the other day. It's like they made, and I did it when I reported it the other day. I wanted to let people know that the media went nuts over this lady that had a desk job in the CIA.
Right.
When Robert Novak wrote that story, right, Rick?
Right.
And they went nuts. But General Flynn, crickets. But let me get back to Durham for a minute here, and not something Rick's left out, but let's make sure you understand. that when this started out, Durham was brought in to just start looking at things, okay, and decide. It switched. It didn't start this way. It switched to a criminal investigation. You need to know that it's an official criminal investigation.
This is
correct?
not about writing a report like we said last week.
Correct,
this is a
Rick?
criminal investigation.
But it didn't, well, I won't say it didn't start that way, but he had to start finding things and coming up with enough that he switched it. And it's now a criminal investigation that they're into.
But with the recent developments with the Flynn case, does this mean his case is going to go even longer? Because he has new things to investigate.
Yes, what I'm hearing and what I'm hearing, and I know with the research Rick's done here, is the Flynn case has opened some things up that he has to look to, and in fact, he probably dots some I's and crosses some T's. It says now we have to look at X. Just saying, wouldn't you think that, Rick?
Yeah, I mean, with the fact that he brought in those federal and those FBI people that were specific to unmasking, I mean, would it seem just coincidental? No. I mean, I'm connecting that dot. He's going there. He's after Brennan and Clapper.
This is not and I'm not saying this in a joking way. It's really getting disturbing. The media, as they call them, open up their newscasts with, and this is not a joke, they open up their newscast with Trump didn't wear a mask. Okay, no pun intended. It's scary to me that private citizens were being unmasked. I mean, America should be very concerned on what happened, and the media is just pushing this under the rug like it's nothing. And then you have this judge, you probably remember his name.
Emmett Sullivan.
He wants to call in an advisor. He's calling in, right? Oh.
Everybody under the sun, and I don't know if anybody watched Hannity last night, but Mark Levin just absolutely excoriated this guy. And he went down constitutionally why he is just so off the rails.
Yeah, because he wanted amicus briefs, right, brought in.
Amicus brief doesn't even apply in this situation.
Yeah,
let me just
highly
bring that
unusual.
up.
District judge
Let me
would do that.
bring
It's
that up
usually
for
at the appellate level.
these two gentlemen to take off and talk about. General Flynn, which we know pled guilty to lying to the FBI, but after we find some things out, we'll just put it like that, they can talk about it. His awesome attorney, Sidney Powell?
Sidney Powell.
Yeah, Sidney Powell, an amazing lady. They get the Department of Justice, the attorneys for the DOJ, to say, hey, we don't want to go with this case. Now, in the real world, if the prosecutor comes up to the judge and says, we're dropping the case, Your Honor, we're not pursuing it, most judges say, okay, well, there's one more I don't have to worry about, and it's off the books. Not in this case. So the Department of Justice has said, hey, we're not going to pursue this case. But the judge says, hey, I think I will. You guys take off with that.
Well, I mean, this judge was given, I think his original appointment came from Reagan, and then he was promoted by Bush to the appeals level, and then Clinton appointed him as a federal prosecutor. A federal judge, excuse me. These are lifetime appointments, aren't they?
I'm not sure.
But you just wonder, how far is this going to go and what's the motivation? He's an Obama sympathizer. He's a Clinton appointee. I mean, he's politicized this thing so brutally. And yeah, we can go through the next 6 to 8 weeks while he finally gets exonerated.
Yeah.
There's some saying that Trump should just pull the plug and just say, it's over. You're pardoned. You're done.
But I think,
I
mean, that just opens up a whole can of worms, abuse of power and all that sort of thing.
Yeah, exactly.
But I think this whole scenario goes back to what Jane's been talking about for over 2 years, that, there is an investigation going on. All these bad people are finally going to be brought to justice.
You think that?
Well, yeah, because
we have tape. we're not going to go in the archives where you haven't felt that confident in the
No,
past.
I haven't, because like I said,
All right. Didn't want to go to the tape.
Stuff like this always comes up, you know.
Okay.
They find a way, and then like, you know, all the media starts talking about, oh, what a brilliant jurist he is, and like, you know, he's got a really good case to bring in amicus briefs and prosecutors and invite the world into a case that he's supposed to decide.
Is there anybody other than myself who just thinks that
Sorry,
Lindsey Graham is just, he's, you know, big hat, no cattle?
Well, we've said this before. They have something
back,
on him.
Let's go a year
They've got
back.
something on him.
Yeah, let's go a year back. I would say
more than a year.
Do we like him now? I would say, do we like him now?
It's been an up and down relationship.
You know, here's the thing, and here's the thing. When Lindsey Graham came out the other day and he says, well, I'm not going to call Obama, you know, and he's backing off. I tell people that this investigation should tie some Republicans into it also. This is not going to be a squeaky clean. This is not going to be down right field only, okay? This is going to be left center too. I mean, there's going to be a couple people on the Republican side. This is not just the Democrats. But I think the Oval Office is ours, okay? It's the American people. And is it January 5th, Rick, that they set in the Oval Office?
5th or 7th, something like that, 2017.
Well, the 5th is when they had the meeting. The 6th is when they sent Comey to Trump Tower. And the 10th is when they put the hook out for the media at BuzzFeed on the fake dossier. They all knew in that room and made a game plan to take a president of the United States down.
Sally Yates, Loretta Lynch, James Comey,
Brennan,
Susan
Clapper,
Rice, John Brennan, and
Samantha Powers.
Samantha Powers.
Rice.
Yeah.
Biden was in there.
Geez, are those the same names that did all that unmasking?
Yes.
Where is Valerie Jarrett? Is her name popped up in any of these meetings?
She's a puppet master.
Okay, so she's behind the door.
She's playing
to speak.
Obama's strings.
Yeah.
So you
Still
think,
living with him.
Let me ask you this, because we've talked about it last week. I won't say it again. And again, Jane, I wish you were here, because this question I know you were iffy on and you've been studying it. What say you, Bruce, on William Barr, our Attorney General? What do you think about this guy now? And do you think some of the comments and the things you hear, he's going to be strong enough to take this the distance?
Well, I think from the beginning, I thought he's been a straight arrow. I mean, he I don't think really he's into the politics of it that much. He looks at things from the basis of law, and that bugs a lot of politicians and media people, because they want him to soften the view, or take all these factors into consideration. BS. I'm going to look at the law. I'm going to make a decision. That's it.
Well, Rick and I, we've talked about, all of us, a mutual friend that we have that said, hey, this guy's a straight arrow when he first got it appointed. Rick, we all did, and Rick had little concerns, and he goes to this guy, and hey, he's a straight arrow. So we've watched it develop. Where do you say, Rick, today with William Barr?
I think he's totally unfettered by all of the gibberish on the sidelines, regardless of where it's coming from. I think he's just focused, and he knows he's protected, regardless of how many people come out and say that they want him to resign, and he should resign because of abuse of power, and he's just a puppet of Trump's. That's just baloney. He's basically told Trump several times, don't screw this up. Quit talking about it.
Yeah, get out of the way. Let me do this.
Let me do my job.
I just hope he doesn't go dove hunting in Texas.
Well, I'm going to tell you this.
They got big pillows down there, I heard.
Yeah, big pillow country.
Every once in a while, and I can't say it's really bad, but every once in a while, Rand Paul will go off somewhere, and I'm like, Rand, I can't follow you on this one. But it was a Rand Paul kind of week. I mean, this guy's had the nerve to say Obama all the way at the top. Did he not, Rick?
Yeah, so did Sidney Powell.
Absolutely, and Ron Johnson of Wisconsin, and Paul.
Did you see him be unkind to Dr. Fauci, though?
Yes.
He was unkind.
Yes. Good. I was staying away from that. Rick was very firm on the COVID-19 when we started, so I was a little nervous to say that. But no, we have Rand Paul. We have a list that says, I watched Marie Bartiromo. I don't come on and like suggest too many programs, really. But I tell you what, you need to watch Marie Bartiromo.
Boy, let me tell you, she's flying close to the sun, isn't
Is she not?
Man, I'm telling you, I hope her wax doesn't start to melt because she really is out there. She's not afraid of anything.
Well, then we have KT McFarland. Good stuff.
KT came out of the box
Yes.
too. You know, she was hammered by the FBI.
Right.
Just like Flynn was.
But I'll just use 10 people this week said it went to the top. Right, Rick? I mean, at least 10 different people said it goes to the top. Barack Obama.
How can it not?
Right.
I mean, of anybody with any common sense, how could it not?
Yeah.
You know, when they've got all these text messages, you know, we've got to let POTUS know what's going on, and
Well, yeah, and then on the masking, the group of why are all these people unmasking? You know, they all have to like get in the gravy train of like, oh yeah, my vote's in. So Joe, yep, I'm in.
keep in mind, unmasking
it's
is not
crazy.
illegal, but you got to have a pretty darn good reason for it.
Right.
Yeah,
What's
with-
illegal is the leaking portion.
Absolutely.
That's the felony part.
Yeah, I mean, there hasn't been a good reason from any of that, group of people. You know, what was it, Samantha Power 7 times? Something like that? I mean,
Yeah.
And how about Biden on Good Morning America on Monday, not knowing the question, and, oh, I thought you asked me something else, and then all of a sudden, the next day, his name's on the list. I want to switch. I want to ask a question. Bruce,
Yeah.
Bruce, this goes to you.
Okay.
So we have no more social, I mean, we are opening restaurants. I don't want to just say Georgia, but we're opening restaurants, and you're traveling, and you walk in, and you and the wife want to stop and have a great meal at this place, and when you walk in, the person says, table for 2? Yes. Can you show me your driver's license? Why do you need my driver's license? I have to make a copy. We have to keep your information for 48 hours. So the question is, Bruce, it's a nice place. You could smell the kitchen back there. You really want to go in and sit down, but
I'd be salivating.
Right. Do you?
And you're really hungry.
And you're hungry.
Yeah.
Okay. Next exit's 40 miles. Okay, done with that. Do you hand that ID to that individual and wait for your number and let them take a picture and hold it for 48 hours? Or you say, no, that's okay? What say you?
Of course you do. This is why you carry false ID. So, yeah, you do.
Either that or you drive to Wisconsin and go to the next bar, first bar that you see.
Not your fake ID from high school.
No,
Bruce.
I think that's like, that's a turnaround. I'm out of here. You're not.
You know what's
getting-
happening?
Well,
There are states to reopen. There are states and places to reopen. Restaurants have to keep your information.
yeah, all this enthusiasm.
Isn't that happening in Washington State?
Yes, and it's outside of Chicago.
All this enthusiasm for all these, social distancing, masks, sitting 6 feet apart, all that. I mean, it's rubbish. That's not the new normal. Let's go back to the old normal. Let's get in there and
All right,
mix up
so
those
what about
germs.
what about contact tracing?
Well, isn't that contact tracing?
Right.
Yeah, no, that's
taking your license. I mean, that's basically how they
BS.
contact trace.
Yeah, I think
So you were in the restaurant. If someone comes up with it, they go back to you and say, "Well, did you get it? You were in the restaurant 20 minutes after this person left."
Okay, so
I reiterate my case for false IDs.
Yeah, there you go.
So last Friday, I left here, and I usually, after leaving here, go over to the grocery store, and I bumped into somebody over there in the strawberry section, and as close as Rick and we were talking. Okay.
Well, you said you bumped into them. I thought you actually.
Okay, Bruce. Serious. So we're talking. We're not this close or nothing, but we're just talking, right? Buggy to buggy, as you do in the grocery store.
Buggy to buggy.
And I leave the grocery store, go home, and the next day I get a phone call that says, hey, I went somewhere and we were with a couple. To come to find out, the couple got a test back. One of them is positive.
Mm-hmm.
So they had to give my name. Not mine. There. They had to give my name.
Mm-hmm.
And I had to go be tested. If I come up positive, I have to give your name.
Doesn't have to do jack.
Wait a minute, that's what they're telling them, and I'm supposed to
Who,
give.
they?
I'm supposed, the health department, I'm supposed to give
Is
your
this,
name.
is this a real?
It's a true story.
And you went and got tested?
No.
Oh, you didn't?
If both of you let me tell the
They're
damn
waiting for the
story.
results of the
They're
fir-
waiting for the
All right.
results.
Of
I
the-
thought you said that
The
result
individual,
was
I think it was
positive.
maybe Sunday. I said, you have to give, if you become positive, you have to, yes, because everybody that I came in contact, and you and I stood and talked for about 15 minutes. And they're telling, and I said, yeah, but what about the person you stood in the line with? And what about the person in the other aisle? But anyway, the point is, and then I think it was Tuesday, I got a message, hey, I'm negative, good news. But if this individual was positive, they were being pressured to give the name of everybody they came in contact with.
And this is through the health department.
Right. And I mean, and yes, but our governor and all the states, they have job offers, $15 an hour to be a contact tracer. I'm just not with that.
You got to remember the survival rate of COVID-19 in the U.S. is like the highest of virtually any country, 99.983% survival rate. So you get it, you don't get it, you're asymptomatic, whatever.
We're not paying people to contact trace anybody that has the flu or a cold.
Exactly. I mean, all this is a different flu. And remember, regular flu, there's a vaccine. And still 50,000 people die a year. Go figure.
What say you, Rick?
The fallout from it is what is the scary part. I got a copy of a Facebook post from a friend of mine, and it was posted by an owner of a local restaurant, and it really was gut-wrenching to read, because she said, I'm working my keister off. I can't get anybody to come to work because they're all getting government money. She said, I don't know if I can keep my business open. My kids don't even want to come into work. And, you know, I don't know if I can keep this up anymore, but I've got a house payment, I've got car payments, I've got insurance payments. And, you know, you just feel really, really bad for some of the way that this has come down, where all of these business owners around here now are suffering, and you've said it before several times. You can't, you put an ad out, you can't get anybody to respond, you can't get help.
What do you think the viewpoint's going to be a year from now? Do you think everyone is going to look at this and say this was like way, way overdone? Or do you think the powers to be will like soft pedal and say, you know, we have your best interests at heart?
Well, best interest at heart. I've always said our government has gotten to the point where they say, you know what, you don't understand what would have happened. Okay, I'm serious. I think the American people need to see what would have happened on something, okay? Not continue to let the government say, and I always say it's like with you know, the collapse of 2008, okay? George W. Bush, which I'm not a fan of, you know, came down the hall and gave the American people 12 minutes and 43 seconds and said, if we don't give King Henry Paulson $800 billion, by the time we wake up, the financial collapse of this country, and we've got to do this now. John McCain stopped his campaign, right? Obama stopped their campaign. They flew back in to vote for this. It was an emergency. But you and I didn't understand what they saved us from. Now, my opinion today, still to this day, they should have let everybody go broke.
Yeah.
Should have let everybody go broke. Should have let the auto manufacturers go broke. Should have let, you know, bankruptcy, not change bankruptcy laws and go broke, okay? But you know what they did? The government came out and said, we did not understand the severity and what would happen and what they saved us from. Now, once again, and you can point to several things, now they're saving us from something. And that's my biggest thing, is I just get concerned when the government saves me from something. I don't believe the numbers. I think Dr. Fauci has to go. Dr. Fauci has served under 6 presidents, okay? And he started with Ronald Reagan, all right?
I don't think he has to go. I think he has to just be ignored, or like, just put in the back corner and just have other people talking at him. I know he's a media darling, but I know he's a media darling, but I think he just needs to be ignored. He's just, all this stuff about you're never going to shake hands again and schools aren't going to open. I mean, the guy's nuts.
So he's nuts, but you don't have to go? I don't understand that one. Nuts. Don't go. Nuts. Sorry, Bruce.
I think there'd be so much pushback if all of a sudden he's just summarily terminated.
Yeah.
Well, I do think if Fauci is gone and they're setting it up. Did you watch the whistleblower yesterday? I didn't watch a second of it. I got a life. I didn't watch. No. I mean, I thought it was hilarious. The guy brought hand sanitizer, wipes, masks. He set everything up so he could, Did you watch it, Rick?
No.
I saw some clips of it, but
yeah. The only thing I watched was Caputo. What's his name? Caputo, the head of HHS.
Yeah.
Made a comment that it's just another ballsy Ford thing.
Oh yeah, the
it's
second
a disgruntled
coming.
Guy who's he's making $285,000 a year, and there's people that don't have a pot to pee in out there, and he's whining.
I think if
Go
Fauci
to work.
Yeah, I think you're right, Bruce. If Fauci went, the media and the left would treat it like James Comey firing, and they would be looking for a special, investigator to look at why he got fired. So I understand maybe put in the corner. I got that, but I'm not a Fauci. I mean, I'm not with Dr. Fauci.
It was hilarious. Just the day before yesterday, Rush Limbaugh at the end of his show said, "Okay, I'm going to let you guys in on something, but you can't tell anybody." This is what he said on his radio show.
Wink, wink.
This is how you need to treat Fauci. You need to treat him with kid gloves. You need to fawn over him. You need to tell him what a great guy he is, how smart he is, how all-knowing he is. And then when he comes up with some information, just put him in the corner and don't pay any attention to it.
Exactly. Ignore him.
He comes on the next day and he said, someone out there blew it. Someone told CNN what I said yesterday on my show. It was hilarious the way you set this up.
Well,
over 2 days.
now this is me on Friday morning just kicking some topics around of Fauci has to go. But I do think Trump is brilliant. I just do. I think the man is a brilliant guy, and I think he's doing just that with Fauci when he comes out and he says, Tony Fauci. Yeah, when Tony, and I think he's good to Tony, but he says it. Look, I like Tony, he's a good guy. We're going to open school up. I'd like
School's got to open. Yep.
Yeah.
School does have to open.
Oh, yeah.
This is goofy.
Yeah.
What we're going through.
Yeah.
What the,
I mean, sports, stadiums, all this stuff. I mean, it's like, really?
The trickle-down effect of schools not being open is demonstrably debilitating, if you will.
All right, so there's going to be the ones out there
How
arguing.
many mothers that are working a second job that can't because they got to stay home with their kids?
No, you got it. Now, you got it. If they open things back up and people go back to work, if they send the kids back to school, people can go back to work.
Exactly.
And you got it. You hit that one out of the park. You go back to school, then mom or dad or both can say, I can go back to work. Okay?
Yeah.
And I will say this, Rand Paul, let me stay on that for a minute. Rand Paul, he hit a lot of home runs because he looked at Fauci and he says, folks, let's just say it out here. We're sitting in a county, Fannin County, okay? We don't have parents. Not every student in the school has parents that have the ability, sorry to say it, to bring their kids home and be the teachers and make sure things get done, right?
Right.
And what did Paul say? The Democrats are always saying, therefore, the poor and disadvantaged. Well, where does the poor and disadvantaged kids make out in this? You know what I'm saying, Rick?
Yeah. Absolutely.
They take a worse beating.
Yes, Rand Paul is 100% on that. He's right down the line on that.
Yeah.
Look, what he said directly to Fauci, I mean, that wasn't unfounded. This guy's a trained medical professional as well.
Right.
Now, granted, he's not an epidemiologist and doesn't have, years and years of clinical studies, but he still has been medically trained. He knows what works and what doesn't work. So I think he's got some basis of background. It wasn't just somebody flippant that, made this remark that didn't like the guy.
Yeah.
Well,
yeah.
If this doesn't come to full circle and they bail him out, but I want to point out something that the underlying fear out there in America that nobody's talking about. Let's talk about bonds. Go to every state in the United States and look at your bond debt, okay? Georgia has enormous bond debt. Now, Georgia has a AAA credit rating, but they have enormous bond debt because what happens in most states, the majority of the states, is when you do your budget, all you have to slide over in your budget is the bond payments, not the outstanding bond itself. So when Georgia balances a budget and they got a $1 million bond and they got a $10,000 payment, all they got to do is slide over the 10 into the budget. Now, Georgia, and I want to say this because this is national. Brian Kemp has come out, the governor of Georgia, and said he wants a 14% mandatory cut, okay? No exceptions. Now, in 2008 and 9, there was
a budget cut.
Right, budget
Okay.
cuts. Budget cuts with no exception. In 2010 and whatever, there were some minor exceptions with school teachers and some things like that. This says, quote, no exception. Now, Georgia House Speaker David Rosser was on my show earlier in the week, Tuesday, and he said 14%, and you can go watch the video, and he said he hopes that's enough. Hopes that's enough. So here's my point. You have stadiums, we'll just deal with stadiums, all across this country. $1 billion. Mercedes-Benz Stadium,
That
$1
are
billion.
backed by munis.
Right? $1 billion,
municipal bonds.
right?
Yep.
Out in Texas, it don't matter. $1 billion stadiums, it's $500 million, all backed by municipal bonds, right, Rick?
Yeah.
And they're empty.
Sitting empty.
And that's just the tip of what's going on in this country. Now, my opinion is the bond companies are a nervous wreck because the last time the country collapsed, they rewrote the bankruptcy laws, and that's exactly why when people don't pay attention, Mitch McConnell set off some major firestorms when he said to like Illinois and them, just go bankrupt. The bonds people got a nervous wreck because what happened last time we allowed something to go bankrupt like that, the bonds are supposed to be the first payout, right, Rick?
Yeah.
And they went to the bottom. So I really think financially, this next bailout, there's a lot of nerves that are shot out there. Do you not, Rick?
This has a trickle-down effect as well. This isn't just at the state level.
Absolutely.
This is at the county level. This is at the municipal level. I mean, you've got Ellijay and you've got Blue Ridge and you've got different counties, different cities that, all have municipal bonds that they floated to pay for schools. They paid for...
Absolutely.
They paid for sewer systems.
Absolutely.
Everything under the sun is being financed that way. When those payments stop making those payments, and the bondholders stop getting their dividends, it could crater.
Remember, this next supposed bailout, which they want to... I'm going to tell you something, fellas. It's a toss-up. I may come back Friday, or if this passes, I may get a job stocking grocery shelves because I want to be one of those heroes that get $13 an hour extra. Right, Rick?
I asked somebody at the Ingles store the other day.
$13 danger pay. This is true. Am I making it up, Rick?
That's what New York's proposing. All the heroes.
Heroes.
People don't understand that if, the economy isn't back to work, government doesn't make $1. All they do is take it and redistribute it. So...
Well, regardless of whether they're up to work or not, the government doesn't make $1.
Exactly. So...
They don't earn a thing.
They don't do a thing. I mean,
But
they basically just,
you
talk
get
about
down-
other people's money.
All right, corporate tax revenue to states. Their in-state corporate, it is down 70%.
Yeah.
Sales tax revenue down. Okay. you got to look at another thing. States are hurting because, remember now, a lot of states paralleled, is it July 15th now that your taxes are, it went from April to July 15th, right, Rick?
Yes.
Yeah. April,
that's the extension.
You're talking about the income tax.
Right.
Yeah, personal income tax.
Yeah. That's been pushed out. So states are not getting, some of the payments.
Oh, yeah. We talked about this before, the fragility of the system. I mean, just in time, it applies to the governments too. Just in time tax revenue. Things have got to be rolling for the flow of money to be coming into the governments and then redistributing it, and that keeps feeding the system. We stop it like this? I mean, it's like a car with like no brakes. I mean, it's terrible.
That's a good way to that's a good way to couch it. I mean, it's a just-in-time payment system that the government's on.
It is.
Well, Nancy Pelosi, what she
Double cash
has,
flow.
and we're throwing trillions around like it's nothing,
Oh, my
but
goodness.
this next plan that she has, it says, quote, states and local governments, because local governments are very nervous of what's going on. Where do you get grants, right? So you go over here and you say, Rick, we're in Blue Ridge, Georgia, right? That's where we're at. So let's say they want to extend a sewer line up to X, right?
Mm-hmm.
And what do? They go in and they fill out paperwork, hopefully to get a grant from the state, right? Where's that money? Is that money going to be there anymore? I mean, there's things like that, and the payments that have to be made. So my biggest thing that I'm talking about, my thing, and I've looked at the camera, and it's not negative to anybody holding an office. Every county, and we'll stay in Georgia, you decide in your state, every county and city need to put a 6-month moratorium on capital spending, period. That means cars, trucks, everything for
do.
6 months. Then in 6 months, do a review to possibly spend X or stop for another year, because this does not come back overnight. The left is making sure, we had an opportunity to have a V economy. We had that. But they've made sure it's not going to work that way.
Absolutely. Private industry is doing that. Private industry has put the skids. It's government that just keeps, spend.
I'm not
and I think the Republicans would be smart, and I think Trump is going to go that way. I mean, all this stuff with Nancy and the $3 trillion next, like you said, I mean, there should be a timeout here. Let's see what's happening. Let's not jump to conclusions. Let's give it 6 months and see where we are. And of course, you can imagine the pushback from the Democrats and state and local governments. Oh, we're dying on the vine here. Come on, we need some help now. It's going to be a really big PR.
All right, I
thing.
will say this. History says that if you're on an economic downturn or trying to come out of a recession, the sitting president doesn't do well. History says that, okay?
Yeah.
George H. Bush, although the recession had ended, officially had ended and started north, it wasn't in enough time for George H. Bush and the people to feel economically comfortable to give him a second term. We start looking at Herbert Hoover, whatever. History says that with, let's say, 30% unemployment, can Trump get reelected in this economy? Can he prove to the people that he's the one to bring it back? Bruce?
I believe he can, because I think he will do everything in his power to get liftoff or create a more positive environment for the country. So yes, I think he can.
What say you, Rick?
I agree with Bruce, and I'm wondering if this isn't going to trigger some kind of a reset on the Fed.
Well, here's the thing, Jerome.
You know what I'm saying?
Yeah.
Jerome Powell.
And it'll be interesting with some of the states that are blue. There's talk more and more of like seeing how some of their leaders have walked us through this, or walked them through this. I mean, that some of those blue states are going to go more red than ever. So,
It's interesting. You stay there with that, because I'm going to tell you something in a second. It's interesting what you said. But Jerome Powell comes out this week, okay? And I really get like this when they come out and the chair of the Federal Reserve Board, Jerome Powell. First of all, There's nothing federal about it. That always gets me just, there's nothing federal about it, folks, okay? And Jerome Powell comes out this week and says, without this next economic package, we don't know that the economy won't be in recession for years. Now, translated, what that means is, we would like for you to borrow some more money from us. Correct, Rick?
Translated, what happened was the market reacted to that, and the market went down 500 points in the next hour and a half.
Yeah.
Remember?
Right.
Mm-hmm. Yeah.
But you need to understand, every time the Fed pumps money into the country, we are borrowing money. It's not the Fed. It just gets under my nerves, skin, burns me up when they come out. He wants another 3. We need to do this. Now, Rick, they're saying we're going to be in recession for years. And they're doing everything to hold this economy back, because what they don't want is, they don't want a news story in September, hey, unemployment has bottomed out, all right, we've hit the bottom, okay, that's one good story. They don't want the next week to say, okay, unemployment was 25%, it's down to 23, 21, so people going into the election can at least see the upside. And they're doing everything to stop that.
Yeah, and I think the bounce back, going from, what were we, 4.4, 4.3%, whatever it was, to 30. I think, that big number is going to come down pretty quick. It's probably not going to get down to 4. We might end the year at 8, 9% unemployment.
You think so?
Yeah.
I disagree with you on that as far as bringing it down that fast. Because what you have to do, they made the unemployment to where people don't want to go back.
Yeah, but they're going to have to, I think. And okay, we can disagree on that, but I think Chairman Powell is playing the role of yin to Trump's yang, or reverse it, whatever you want. I think he's.
Is that the role of the Fed though, to come out and politicize something?
No, but I think they have such a relationship that he's going to be whatever Trump says, I'm going to pour cold water on it, because I'm the voice of reason and I know the numbers. And Trump is always portrayed as that's the doofus. And again, I think the media, whatever happens with the unemployment, the media is going to push this whole thing about, look at the debt that this guy has piled on. They complained about Obama. Look at what he's done. And the fact that it happened because of this virus, he's not going to get credit for that. They're just going to pound on that 3 trillion, 4 trillion more in debt.
Okay. I want you to elaborate a little bit on the blue state, what you just said, that Trump may even do well in some blue states now.
Well, I think a classic example is Michigan, Gretchen Whitmer.
Right.
I think she has so aggravated people. I don't know why they voted for her, but with her actions and statements going through this process, I've read some stuff that that state's going to be in play. I mean, in terms of flipping. I mean, and think about it, Detroit.
If I lived in,
Union.
there's something on the internet today that says that California.
Okay, stop.
California.
Stop.
Peter Navarro.
You went right. Stop. Okay. Listen, yesterday. No. The reason being is I'm enjoying so much this coming from you guys outside looking in, because yesterday President Trump went out to the Lehigh Valley, Fogelsville, out there, right there in Allentown, right outside of Allentown on Route 100. And he went out there 60 miles north of Philadelphia, and Northampton County, which came in as one of the top 5 counties in the United States, they're looking at again to try to make sure Trump wins re-election. That being said, many of you know my sister's the chair of that GOP, and many of you know my brother Jerry's never seen a Trump rally he wouldn't drive to. Okay, but that being said, okay, we're talking about some people that have been to Trump rallies. Okay, Jerry's been to 3. He was in Hershey, 2016. Thousands lined the streets yesterday. Now I have pictures; they're all over the internet. The media is not going to tell you. Now we're talking right in the Lehigh Valley, not Alabama. Thousands lined the streets to see the motorcade. Thousands, for miles. I don't know if you got to watch it yesterday out there, but the media will always say Trump makes stuff up about numbers. You remember yesterday he said it was good to see thousands of people as I was coming in today, right, Rick?
Yeah, and you wonder. You're exactly right. And the interesting thing was to hear the interview of the CEO of that medical services manufacturing company.
The one he visited.
He was blown away. He said, "Man, the people, the support, the turnout."
Exactly.
That was huge.
Now, here's where I'm going to what you said. My brother called me last night. He said, "Brian, this is bigger. It was as good as a rally." He said, "I'm telling you, this was as good, if not better, than one of the rallies." He said, I was like third row behind him in Hershey. I've been to the rallies." He said, "Brian, thousands." He said, "The people love this guy." Now, not the academics, the people. He said, what I seen yesterday, he said, I wouldn't get shocked if this guy doesn't take California. And he started rolling out. He said, the people love. So when you said that, I'm just telling you, that's what I was told
Well,
yesterday.
you see the little nugget? CNN did this poll, I think in 12 battleground states, that Trump is leading Biden by 7 points.
Yeah. CNN poll.
A CNN poll, and they mentioned it on one program one time.
Yeah, exactly.
And we'll just get on to like the national polls.
Nothing
want us
to see here.
Yeah.
You want us to do this poll on the air? Yeah, we did pay for it. Run through it real quick. Takes 2 minutes, 30
Pretend
seconds.
like no one's listening.
Yeah.
Oh, really? They're not anyway.
So, again, I mean, it's the fallacy of polls. I mean, you can mine a poll and get whatever you want out of it.
Okay,
Absolutely.
But here's the second part of that. I don't see my dog yet, but here's the second part of that. Pet of the week. When I
Maybe a
say
cat.
For those of you that don't know out there, I said I don't see my dog.
Maybe a parakeet.
Maybe she can't be here today. Maybe she had to be somewhere and told me and I didn't remember, but the world won't end. But here's the thing. He said, Brian, this man will win a landslide in this country. The only thing they could do is steal it. And that's what we have to watch for. And that's
mail-in ballots.
Steal it. And that's the only thing we have to watch for is
Ballot
stealing.
harvesting.
Ballot harvesting. Look at Nevada. Nevada's. It's corrupt. Some of the way they're doing this voting in Nevada.
Well,
all these mail-in votes are laying there not counted.
Why do you think they had Harry Reid as a senator for all those years?
Yeah. Harry Reid, the boxer.
Yeah, the
Harry
boxer.
Reid, the boxer.
Yeah.
Okay, folks. Now I don't know. I was probably told. Usually after the show, somebody says we told you this. So I don't see my pet of the week from the Humane Society. So let me do this. Let me make sure. I know you started out with your stack of stuff, Rush. Over there, his stack of stuff.
Stack of stuff.
Right. Bruce, what subject did we want to make sure? Now, it's not winners and losers yet, but what subject did you want to cover this morning?
This is back to you because you're involved with local stuff all the time. I've been seeing all these ads of all these people that are running for the districts here in Georgia, and the 9th particularly, and just like to maybe get an overview from you on where that stands because. There's this Army veteran that's running in the 9th.
Yes, he's over in Athens. That's Andrew Clyde.
Right. Where does that race stand? And maybe just kind of an overview of Georgia races.
I'll tell you where that race stands. Sadly, it was there was great opportunity for a grassroots candidate, whoever it may be. I'm just throwing some names out. Kelly Weeks. Maybe Andrew Clyde.
How many candidates are there?
There's 9.
9
but
for the 9th.
Let me tell you something. Let me tell you what really changed is I would have this answer for you right now in normal circumstances because what normally would happen during election time is there's 20 counties. Banks County would have the Republican Party meeting and I would be there hearing from the people. That all went away.
All stopped.
All went away. So realistically, me be able to say, how is this going to shake out? There's no clear indicators like there used to be. So my opinion is it's going to come down to money. It's going to come down to money. And what I mean by that, if you look at the top money people, Kevin Tanner, Matt Gertler, Evan Underwood, or some of these candidates that have some money this week, every time you go on the internet, every time you do this, that, you're going to see their name.
Yeah.
That's the best campaigning they can do right now. So there's no clear. I mean, Andrew Klein is a great guy. I know him. Dr. Paul Brown is a good candidate.
So a lot of good candidates, but
they can't get their message out and can't
the
get
traditional
out from
way
under.
of campaigning is passe.
Right.
And primary is the 11th, and the top two go forward. Is that it?
No, June 9th, right?
June 9th is the.
I thought it was the 11th.
No, June 9th.
Okay, 9th. Okay.
And I think early voting starts late
Monday.
next week.
Monday.
But
18th.
Monday.
Yeah.
You know, I don't believe in early voting. I just don't. I believe anything can happen. There was something that doesn't come to mind right now. Is a great example of something came up a week before the election, and I was hearing people say, I wish I would have held my vote, so I'm not an early voter.
Yeah.
Go ahead,
Okay,
ask
but,
anything else.
The 9 candidates, there's a Democrat or two in there, or are they all Republican?
No, they're all Republican. Now, there's a 9th congressional district. There's 2 Democrats, but they're not on the radar until
after the primary.
Yeah, after the primary. There'll be a runoff in the 9th. So the 9th runoff is July something, I think. I think it's July. I got to check that out. But there'll be a runoff between the 9 candidates. And what I meant by that is if you could have had traditional campaigning, somebody that didn't have the money but had the energy to just door to door and go to 20 GOP. I mean, normally, if you're a candidate, you're scheduling yourself to speak at every Rotary Club, every men's breakfast,
high school, nursing homes.
Exactly,
Yeah,
but right now you can't do that. So that hurt the grassroots. It will be down to money. I was hoping to, and I probably won't get a chance. I was hoping to pull 5 out and
another debate,
do another debate, but. It's hard to say to the last 4 you didn't make the stage. So I probably will hold that to a runoff. So I'll probably moderate a runoff debate.
Take it to the Senate level. What's your opinion of Ms. Loeffler now that Richard Burr has seemingly got himself in deeper hot water than maybe originally thought?
I posted something yesterday, and I'll call her a young lady. How about this? Maybe you guys can. Everybody's starting to be younger.
She's 49.
Is she? Now I posted this yesterday, and a young lady said I was the only one, because I said, would Kelly Loeffler be next? And the young lady went on and said I was the only one still following the story. But they seem to be Loeffler supporter.
The other one that's following the story is the FBI.
If Burr's, everything's circumstantial. Burr and Loeffler sat together during the impeachment trial, okay? If Burr's phone shows up some things of interest, and if the FBI asks Kelly for some documents, I'm not for sure, but...
You know why they took his phone, right? Because his brother-in-law did the same thing that he did, and what they're trying to do is they're trying to see if there were phone calls to his brother-in-law right after that meeting.
Yeah.
Right.
Now, if Feinstein, who's also been interviewed by the FBI, and Kelly Loeffler has been interviewed by the FBI, if they didn't make any phone calls, if they didn't tell anybody, then it's just, should they have done that? But if he's pulling a Martha Stewart, and she gets on the phone and someone calls her and says, you might want to think about selling this, and then she goes to jail. That's another story, I think, for Burr. That's why he's sticking out like a sore thumb.
If Burr goes down, will he go down alone? That's my...
Yeah.
Well, that's the point, but yeah.
One of the things that I wanted to throw in that I didn't talk about earlier, we all know well, maybe we don't. A 302, you all know what a 302 is?
Yes.
302 is the written information by the FBI after they question somebody. All of a sudden, the 302 that contained the information that said that Flynn lied, poof, gone, missing, nada. Clean out your locker. It's nowhere to be found. Devin Nunes is livid, and Trump came out last night. He wants to know where the 302 is. They can't find it. Now, really?
I will.
How does 1302
Went to the same hellhole Hillary's 33,000 emails
Yeah,
went
that's
to.
right.
Well, saying that,
The eye dump in the
don't we
sky.
also, Schiff did not want to declassify those. What am I? The
302s?
No, he didn't want to
the notes from the secret
right,
meetings?
right. And Grinnell, which is
the interviews.
Yes. Okay. Depositions or whatever. But Grinnell's come along and he's become. I tell you what, Rick Grinnell's done a very good job, and he has declassified this stuff.
Yeah.
And don't we have a little note there that says CrowdStrike?
CrowdStrike.
Is that his CrowdStrike?
CrowdStrike was the private firm that was hired by Debbie
Wasserman
Schultz.
Right.
To say, when the FBI came to the door, no, we got this. We've got a private firm that's going to take a look at it.
Exactly. FBI came over. They've never looked at the server.
The computer hack.
Right.
The computer hack.
And the allegation now is that there was no computer hack from an outside source.
That's right.
It was an inside job made to look like a hack.
And that's
And
why
that circles all the way
and
back
that's why
around
I
to
brought to the
Seth
Seth
Rich
Rich thing
is dead.
and the WikiLeaks dumps and Julian Assange.
Right.
Assange.
Yeah.
And the only reason this came out, and I'm not going to go back to it in depth, but the only reason it came out was because Judicial Watch, Tom Fitton, is that right?
Yeah.
Yes, Tom.
Judicial Watch
Good group.
inadvertently obtained records about Mr. Rich by requesting communication between, guess whom? FBI lawyer Lisa Page and supervisory agent Peter Strzok. Strick.
You're going to say
Strikes again.
There's
You're
a
gonna
heavily
say-
redacted. Let me
Go
just
ahead.
finish this. There's a heavily redacted piece in the email that they uncovered when they were looking for stuff and inadvertently found this about Seth Rich. Agent Strzok boasts about having squashed something pertaining to Mr. Rich. In the redaction codes on the email indicate there was some sort of investigation pertaining to Mr. Rich, and this is why this attorney wrote the letter to Grinnell saying, if you make this, if you declassify some of this stuff,
Yeah.
it could clear up a lot of mystery.
Well, you're 100% right, because I want to throw it out there. You guys do your study, CrowdStrike. Let me just say this. You remember the media making fun of us? I tell you what, if I was to pick a hero, all right, the day Devin Nunes rushed over to the White House, came out, and was actually almost pale to a point of what he found, right, Rick?
Yeah.
Now, people are not laughing at Devin quite much.
No.
Right?
Yeah.
Air balls, jump shots, it's 9:57.
Home runs. Carl Menke, the guy who had a barber shop up in Michigan, reopened his shop in defiance
77 years old, right?
Yeah. 77.
Right.
In defiance of Gretchen Whitlas. Basically, she couldn't do anything, but the licensing agency stripped his barbershop license, so he's probably going to be shut down. But I think he's going to get a lot of outside support, kind of like some of these people that, do stuff and then they get a bunch of money from
They'll have a
outsiders.
GoFundMe page and they'll get millions.
My airball is the New York City Health Czarina, otherwise known as the Commissioner, Oxiris Barbeau. When asked if the New York Police Department could get 500,000 face masks, says, I don't give two rats' ass about their face masks. I got other needs for them.
I like that.
They're loving her.
How does she get away with saying that?
Yeah, I don't know.
My winner of the week is Rick Grinnell. I mean, I think he's done more to unmask, to uncover, to declassify the deep state than anybody has come along in a long time. So that's my winner of the week. I had two losers, and I don't know whether it should be Burr, Loeffler, and Feinstein, or whether it should be my old boy Adam Schiff. If anybody wants to see a corrupt human being, Gutfeld is pushing to say, why aren't some of these people, just because they're in the well of the House and they sit there and they lie, and then they go outside, and then they're behind closed doors, and they're in testimony under oath, and they say something totally different. How is that right? If anybody wants to know anything about Adam Schiff, just Google Adam Schiff, Ed Buck, Standard Hotel, District 28 in California. You will be shocked, because I contend that guy's being blackmailed.
I have one more thing. I have some breaking news. John Travolta's been hospitalized for suspected COVID-19. Doctors now confirmed that it was only Saturday night fever.
There was no Saturday night fever.
Did you really do that? Did you do that? I'm all queued up for my serious view of closing the show.
And they assure everyone he's staying alive. Apparently he had chills and they were multiplying.
All right.
That's a good way.
That's a good
I got to
one.
go to
All
a
right,
board
folks,
meeting.
my winner this week, I don't particularly like the guy, but whatever. He makes the news quite often, and it's usually something controversial. But my winner, I'd call him Elon Muskie. Oh, Elon out there in California says the factory's open. You shut it down, I'm leaving. I'll be in Texas, Utah, but the factory is open, Tesla. So, hey, I like it, Elon. Open the factory. California don't like it. They want to shut you down. He's going to go to Texas, okay? Now, my loser is we have some great governors across this country. We'll just leave it at that. Then we have the blue state governors, okay? And these are some real pieces of work. But underlying every governor in the United States is that Secretary of Health or the Director of Health. And strangely enough, these are the people running the country via states, okay? The health, whoever Secretary of Health in your state is going in and telling your governor, you got to do this, this, and this. Well, happens to be in Pennsylvania a he, she. We don't know if it's Richard Levin or Rachel Levin, but Richard would like to be referred to as Rachel. He or she has the long hair, everything. So the other day, now this is the person that Tom Wolf, the governor of the state, appointed, one of the first transgender top officials in the United States, Richard Levin, is running the state. The other day at a press conference this week, a reporter referred to Rachel as Sir 3 times. And then finally, Rachel looked at him and said, "Stop misgendering me. Stop misgendering me."
Don't you see these pearls?
Yes. A man in, nothing like a man in pearls. People, that's who's running some things around this country. I'll be back. Whew, man, state's closed. They cannot sell and transact real estate in the state of Pennsylvania. But you know what I do know? The bars are open in Wisconsin. Hit them this weekend, man. We'll be back Monday morning. Thank you, Circuit World here in Blue Ridge. Enjoy your weekend. Thank you, guys. Yes, John Travolta's all right. It's only Saturday night.
He's staying alive, folks.
Staying alive. Let's go.